Sharon. I'm a family nurse practitioner. Some of our job as family nurse practitioner is to educate the public about prevention, early identification, and early treatment. This channel is not for diagnosis and treatment of diseases. Rather, is to enable you to know some of these diseases that you are able to identify and that are curable, that are treatable, and some of them people have them and they don't know they have them. So people like us are here to let the public know what they can do to identify these diseases early and start early treatment, or do what they can do on their own by exercising and watching what they eat, because most of these diseases and illnesses are caused by what we eat and our lifestyle. So the topic we're going to talk about today, or we're gonna treat today, or gonna discuss today, is hyperlipidemia. Hyperlipidemia, as other people they also may call it high cholesterol, is a bad cholesterol that our body make. We are going to discuss what hyperlipidemia is, the causes and risk factors, the recommended monitoring periods by American Heart Association, the symptoms and damages it could cause to your body, how it is diagnosed by your medical providers, and the treatment available. What is hyperlipidemia? Hyperlipidemia is high fat in your blood system or your blood vessels that is wrong. So most of them are built up over time. Most of them are inherited. And most of them are caused by our lifestyle, meaning that people that are not very active. So hyperlipidemia is caused also by the food we eat, which is one of the major factors. Like we all know, health is wealth, and prevention is better than cure. When you know about something, you're very empowered to do something about it. So, and when you do something about it, that is what is called prevention. Cheaper to prevent than to cure. And to get to that level of curing, sometimes more damages have been done. Let's dive into it. So what are the causes of hyperlipidemia? There are three, but there are good ones and there are bad ones. We'll talk about it as we go through this video. Bad cholesterol is mostly caused by the food we eat. Saturated fats and trans fats, they can raise our blood cholesterols. So things that have most saturated and trans fats, food that have most saturated and trans fats in them are food like cheese, egg yolk, fried and processed food, ice cream, pastries, and red meat. So the foods where you find most of and there are many of them. So the food where we can find most saturated fat that could cause elevation in your cholesterol. What are other risks that causes high cholesterol or hyperlipidemia? Or there are other health issues, ongoing health issues that could raise your cholesterol. And this hypertension, diabetes, cigarette smoking, obesity, coronary artery disease, peripheral artery disease. Those are risk factors that, if you have them, it's going to affect your cholesterol, or your cholesterol can affect them. So not exercising frequently also could, increase your cholesterol, because when we inject these fats inside our body by eating, we have to be active, to be able to digest them and get rid of them from our body. Only exercising, as we get older to our activity level, most people, the activity level reduces, start building up cholesterol in their body. And hyperlipidemia could also be hereditary, could be inherited, could run in the family. What are the symptoms and risks of high cholesterol? Okay, to be frank with you, hyperlipidemia has no symptoms most of the time, but the damages it causes is what people feel. Let me tell you what hypercholesterol does. So it goes into your blood vessel, into your artery. Artery is the blood vessel that transfuse blood, that transfer blood to your tissue to get oxygenated. When your blood carry this fat in them, you eat them, they go inside your bloodstream, go into your arteries. The blood vessel, the arteries, is transferring them to get into the other body tissues that need the blood. What they do is that these bad fats, they are like wax, they start building up in your blood arteries, in your blood vessels. Over the time, they keep building up and building up. As they are building up, okay, let's see it as a pipe, or as a straw, the blood vessel. Let's take the blood vessel as a straw you drink with. So as the blood is passing through the straw, the cholesterol is building up around the straw. So over the time, it keeps taking space, and clogs up the straw. So when blood tries to pass through the straw, it's not able to pass through that straw. And what happens? The tissues that the blood vessel transport blood to get deprived of blood transfusion. And what happens to those tissues? They die. So think about the arteries that transfuse blood to your brain, and they get clogged up, closes up, narrowed up with bad cholesterols, with a lot of cholesterols your body have built over time and you don't know. And your brain, can't get blood transfusion. What happens? Your brain tissue dies. Same is your heart. The vessels that transfuse blood, transfer blood to your heart tissues. And those are the arteries, different kind in your heart. And they clogged up. What happens? That's when they say people have heart stroke. That's when they say people have heart attack. That's when people start having pain in their chest area. It could be woman, it could be man. So that is the symptoms and the high risks of these cholesterols. So it causes a stroke, heart attack, and other health issues, and it causes also deep vein thrombolysis, and it also causes blood. Example is that it could cause pulmonary embolism. So when those fats start clotting up, and they can break and start transferring into your blood vessels, and they will clog up your lungs arteries. And that's when people can't breathe anymore. This is very serious, and we need to take it serious. And that's why I'm letting you know how important it is to get checked out. Sometimes skinny people can have high cholesterol because of the kind of food they eat and because they inherited it from their family. Anyway, let's continue. So, how would your doctor diagnose this cholesterol? You're not going to be able to know if you have high cholesterol or not until they run some lab, your lipid panel, to check your cholesterol level. So that's why it's important for you to go to your doctor, and your doctor will order this lab. It's called lipid panel. So in this lipid panel, it has three elements. One is LDL, which is the bad cholesterol. So it is required that LDL has to be under 100. Good cholesterol is called H, supposed to be more than 40. So there's another one, which is the triglyceride. It's another bad fat in the body that could cause other health issues like pancreatitis. Triglyceride is required that it is under 150. And there is a total cholesterol, which is a combination of the other three I have mentioned. So the monitoring by American Heart Association. It is recommended by American Heart Association that anybody that is 20 years old and above should get their cholesterol check every 4 to 5 years, or every 4